and today I am talking about nutrition for optimal brain function. My name is Dr. Terrie Van Alstyne. I'm a naturopathic doctor. I've been practicing for 20 years, and I have a lot to talk about today. So hopefully I won't overwhelm you, but I do want to give good value for your time. So, the brain. The brain is involved in everything we do, including how you think, how you feel, how you act, how well you get along with other people. It's the organ of personality, character, intelligence, and every decision you make. From brain imaging, we see that when the brain works right, people work right. And when the brain is troubled, people are likely to have trouble in their life. With a healthier brain, you're happier, physically healthier, wealthier, wiser, and just make better decisions, which helps you to be more successful and to live longer. When the brain is not healthy for whatever reason, such as a head injury or past emotional trauma or nutritional deficiencies, people are sadder, sicker, poorer, less wise, and less successful. The brain is the control center for the body. It takes in information and sends messages to various glands, organs, muscles, and systems to respond in the appropriate way. The brain is not the mind. The mind is in every cell of the body and is more like our soul or inner source. Essential nutrients for the brain. So these nutrients are absolutely necessary for any recovering brain for sure. If there's been a brain injury, and also just for general optimal brain health. They are also, all of these vitamins and minerals are important for the production of neurotransmitters, which are like the hormones in the brain, serotonin and dopamine, etc., GABA. So they affect mood, appetite, and behavior. And you see the list of them. It's basically B complex, folic acid, vitamin C, magnesium, and omega-3 fatty acids. Nervous system requirements are required from infancy on for the brain and nervous system to develop. So we require these specific things. And a deficiency of any one or more of these nutrients can cause irreversible nervous system damage, altering personality, mental function, and behavior. B1, thiamine deficiency. You can see the symptoms of that. And sources are, on the bottom right, pork, beef, organ meats, whole grains, nuts, peas, and beans. So yeah, B1 is just one of the B vitamins that we are definitely requiring for optimal brain function. So here are some of the symptoms you can see for B1 deficiency, known as beriberi. Just want to check my text. Somebody just texted. Okay. Sometimes people text when they can't make it onto the webinar. So B2 riboflavin deficiency causes depression, hysteria, and lethargy. And sources of riboflavin are liver, dairy, oysters, meat, dark green leafy vegetables, eggs, mushrooms, asparagus, broccoli, Brussels sprouts, tuna, and salmon. So hopefully everyone gets enough variety of these foods to replete any riboflavin that's deficient. Vitamin B3 or niacin deficiency, there's the list of symptoms of niacin deficiency. And when we think of niacin deficiency, it's the 4 Ds: depression and dementia. It's dermatitis, so skin issues. It's diarrhea or digestive tract issues. And then eventually it causes death. And what's interesting is that in the 1800s, there was an epidemic of schizophrenia. That's what people were being diagnosed with in the southern United States. And they were all eating corn. And corn is one grain that does not contain niacin. And I guess they weren't getting niacin from anywhere else because they had the symptoms of schizophrenia and they went into mental institutions. And the scientists working in those institutions tried giving them niacin, and most of those people recovered completely. So, yeah, they had like disorientation and depression and dementia and schizophrenic type symptoms. B6, pyridoxal 5-phosphate deficiency, causes emotional disorders, depression, insomnia, confusion, irritability, and nervousness. And the picture shows all the sources of vitamin B6. And I'm sure that the people, a lot of the homeless living on the streets, are deficient in all of these nutrients. And that is a big part of the reason why they can't function in society and are living on the streets. And if the nutrients were replenished in their bodies and they were detoxified properly, and of course, in some kind of program for recovery or of, from drugs and alcohol, that many could resume normal life. So methylfolate, folic acid deficiency. So methylfolate is the term for the form of folic acid that the body needs. And in some people with genetic defects, they're not able to convert folic acid into methylfolate. And so we can buy it as methylfolate and take it in that form. So the deficiency causes irritability, weakness, apathy, hostility, depression, paranoid behavior, and anemia. And the picture shows where we can get methylfolate from. And you may know that this folic acid or methylfolate deficiency in pregnancy can lead to neural tube defects. So that's something that pregnant women definitely need to be taking. And B12, methylcobalamin deficiency, causes nerve damage, tingling, moodiness, confusion, delusions, and disorientation. And if anyone has any kind of a nervous system issue, like eyelid twitching or numbness and tingling, they definitely need to be taking methylcobalamin. But you can see, patients living in old age homes that are fed garbage and no vitamins and minerals are often suffering from a lot of these conditions, and it's because of all the B vitamins being deficient in their diet. Vitamin E deficiency, nervous system disorders, anemia, depression, fat malabsorption. So fat malabsorption means they're not absorbing fats properly and they're not absorbing fat soluble vitamins like vitamins A, D, E, and K, which are all very important. Vitamin E deficiency leads to nerve damage, coordination problems, anemia, heart attacks, and strokes. So anyone with a cardiovascular risk definitely needs to be taking vitamin E. And mineral deficiencies are very common, particularly magnesium, but some people are deficient in calcium, iron, magnesium, selenium, and zinc. And this will lead to depression, anxiety, and mood swings. And so we should be getting our minerals from all of our produce grown in soil, because the soil should be rich with minerals, and so should our water, but it's not. It's been stripped of minerals for decades with commercial farming practices and pesticides and herbicides and other types of fertilizers stripping the soil. So I am a big proponent of patients taking a multi-mineral complex as well as a magnesium glycinate. We do get, as I said, magnesium from plants, but they are deficient. However, if you are eating organic, you're definitely getting a lot more nutrients, probably 3 times that of non-organic produce. Vitamin C improves mood, cognitive function, and anxiety, and these are the foods it's found in. Vitamin C is destroyed through cooking, so it's super important to be eating some of these raw at least. Choline deficiency causes memory loss, and we get choline in these foods in the picture. And which brain do you want? So we can see in the picture what a healthy brain looks like at the top left, and the healthy underside of the brain, and then what meth does to the brain, what on the right hand side 4 years of marijuana does, what 10 years of alcohol does, 4 years of smoking, 4 years of cocaine, and 6 years of opiates. So it causes both physical damage and, of course, functional damage. How drugs affect the brain. So drugs cause all of these issues: impulse, emotional, memory, feeling like they need to be rewarded, more rigid in their thinking, not flexible, issues with reflexes, and mental health issues. Meds with mood side effects. So hormones in the form of hormone replacement therapy and bioidentical hormone replacement therapy impact mood by impacting neurotransmitters in the brain. Sometimes this can be a good thing, such as in menopause, if a woman's feeling emotional, irritable, or out of control for no other reason than an imbalance of hormones. By using bioidentical hormone replacement therapy in low doses will help regulate levels and restore depleted neurotransmitters. So it can change a woman's life. Because of the proven risk of HRT, that's conventional HRT, causing heart attacks and strokes and estrogenic cancers, bioidentical hormone replacement therapy in low doses is preferred and generally well tolerated. Before handing out prescriptions, doctors weigh the benefits and dangers of their use by the patient. The growing popularity of prescription drug abuse comes from the fact that these drugs are taken to elicit feelings of well-being and euphoria. And prescription addiction is growing. And, you know, here's the list of all the different drugs, and I'm sure you're familiar with the impact of these on how people feel and the addiction potential for all of them. I won't go into detail, but that's a whole other webinar on its own. I've got pages and pages of information on each of these. And meet the neurotoxins. So these are all toxic to our brains, our entire nervous systems. And a leading scientist recently identified a dozen chemicals as being responsible for widespread behavioral and cognitive problems with children and with the poor, who are most susceptible to neurotoxic exposure. So Dr. David Bellinger is saying that there 41 million IQ points are lost collectively with exposure to lead, mercury, and organophosphate pesticides. And that mothers exposed to these neurotoxins while pregnant have babies with like 16.9 million IQ points less than the control group, and particularly those whose parents work in agriculture. So they're being exposed to the pesticides and herbicides being sprayed. So 12 chemical substances found both in the environment and everyday items like furniture and clothing are believed to be causing not just lower IQs, but ADHD and autism spectrum disorder. So chlorpyrifos is just one of 12 toxic chemicals affecting fetal brain development. And it's in can't remember where you find it. The chlorpyrifos. Oh, it's in pesticide sprays, yeah. So it's pretty depressing what we're exposed to and what our babies are exposed to and the impact on brains. And as far as chemical toxins that damage the brain, MSG, tyramine, which is in aged cheese, gluten, sugar substitutes, refined sugar, trans fats, bad fats, fluoride, and non-organic foods. So gluten causes an opioid effect on the brain. So for me personally, it puts me to sleep. As soon as I eat it, I feel like I've had the flu. And I want to go to sleep immediately. So sandwiches are not a good idea for me at lunchtime because I'll just be asleep for the rest of the day. MSG is found in Chinese food and fast food, and even Japanese sushi restaurants use it. It's an excitotoxin. So it excites the neurons in the brain, it short circuits them, and overstimulates basically. It's also in a lot of packaged foods, canned foods, meat, crackers, frozen dinners, chips, beverages, noodle soups, salad dressings, protein powders even. So if you're exposed to it long term, it can exhaust and weaken neurons involved, resulting in neuronal death, which is brain death. And I had a patient come in who had permanent neurological damage in his feet. And he said that after eating MSG in Chinese restaurants for years, his feet swelled up like crazy and became permanently numb. Aspartame's not on the list. Oh yeah, sugar substitutes. So it has been linked to dementia and seizures, and it's also quite addictive. So it's in the diet pops and that kind of thing, and not a good product. It doesn't seem to work because people that drink those diet drinks are often gaining weight rather than losing weight. One that's not on here is phenylalanine. It's found in protein-rich foods like milk, eggs, and meat, and sold as a dietary supplement. It's a component of aspartame, so something to avoid for sure. And alcohol, of course, that's not on the list, but it is definitely a neurotoxin and damages the brain and the liver and all the other organs as well. Highly addictive. Our bodies are not meant to ingest it. So just be aware of that. Trans fats and bad fats, they damage neurons in the brain because of the free radical damage. And fluoride is also toxic to brain neurons and non-organic food because it's full of heavy metals. And then nitrates are also toxic to the brain. So that's in processed meats, hot dogs, salami, sausages, and things like that. Nicotine is not on the list here, but it is toxic as well. It restricts blood flow to the brain, and so the brain doesn't get the glucose and the oxygen it requires to function properly. And that's it for that slide. So you can see the difference in the size of the brain on either side of this slide. So this has to do with pH, which is the acid alkaline balance of the body fluids and tissues, leading to Alzheimer's in this case. So acidity can cause brain and health issues. Health benefits are achieved by balancing the body's pH. And a lot of people are acidic, and it's caused by irregular eating patterns, fad diets, coffee, sugar, alcohol, stress, smoking, unhealthy diet, and sedentary lifestyle. And the pH or acid alkaline balance of our bodily fluids is one issue. And I'll talk further about it here and show you how to test it. So you can see the chart showing the various pH down the left-hand side of circles, and what causes that pH, or what would be associated with causing that type of pH in the body. So normal pH or neutral is around 7. And we want to be at the perfect is 7.2 pH. And so some healthy foods do cause more acidity in the body, like tomatoes and lemons, but coffee is quite acidic, and water, if it's not alkaline water, well, it's at 7, but it can be more acidic than that actually, and you can test it. And you can see like drain cleaner's the worst for acidity, or right. So battery acid's the worst for acidity. Alkaline's along the top. So minerals are alkaline. And then there's a chart on the right-hand side showing foods and the level of acidity or alkalinity of those foods. So meats are more acidic than vegetables in general. So we want to keep the meats lower and the vegetables and fruits higher in our diet. And we can test our pH by buying pH paper and testing our urine. So it will show yellow to light green if you're acidic, and darker green to blue if you're alkaline. And we don't want to be too alkaline either, because this will cause other health problems. But most people are definitely acidic because most people are eating the foods that cause acidity, like sugar, pop, junk food, meat, coffee, alcohol, dairy, bread. Those are all acidic, and they're not eating enough alkaline vegetables. So tying this back to the brain again, remember what can happen. This right-hand side of the slide shows that it's actually shrinking. So here's a list of brain support products by Pure Encapsulations, which is my favorite company on the market. It's the cleanest, it's vegan, and it has quite a list, as you can see, of phenomenal brain support products. So if you feel like you need something to improve your brain, you may want to consider coming to see me or another naturopathic doctor to hone in on exactly what's going on and determine what the best product or products would be for you. And also whether you need detoxification. I think everyone can't avoid the toxins. They're in our environment, they're everywhere, and they're impacting our bodies and our brains, and they're causing chronic health conditions and cancers. So there are so many chemicals and heavy metals that cross that blood-brain barrier and enter the brain. Radiation from cell phones causes brain tumors. All these chemical toxins and heavy metals impair brain function, causing memory issues, foggy brain, and processing disorders and abnormal behaviors, and definitely cause brain degeneration, such as Alzheimer's, Parkinson's, dementia, and brain cancer. So I've put together a core healing anti-aging detoxification program. It's outlined on my website under services. And I take groups of people through 4 weeks or longer of comprehensive detoxification of chemical and heavy metal toxins. So patients use products that I've formulated in a heavy metal detox smoothie and follow a recipe book and manual that I've put together to just gently but efficiently eliminate, as you know, the maximum amount of chemical and heavy metal toxins out of the body. And they feel and look amazing afterwards. And it takes years off their life in the way they look and feel. And it adds years onto their life because by eliminating the toxins, people will live so much longer and feel so much better. So improving our brain for sure, but also our health in general. So optimal brain summary, we need specific nutrients for the brain, such as B complex, omega-3s, and magnesium. For the nervous system, we need B6, B12, zinc, iodine, protein, methylfolate, which is, folic acid. And those are requirements for a developing brain, specifically for the mother to be intaking while the baby grows inside. We talked about the food sources for each of these important brain nutrients and deficiency symptoms. We talked about how drugs and medications affect the brain, about neurotoxins, food chemicals, pH in the brain support products, and that we need to detoxify the brain and the body. So thank you very much for attending. Again, I'm Dr. Terrie Van Alstyne. I work in White Orchid in Yaletown, Vital Synergy in North Vancouver, and I'm available for virtual consults. The rest of the time, I live in Whistler and maybe joining a clinic up here part-time as well. And I'm open to any questions that any of you have. I know it was a lot of information. Hopefully I didn't overwhelm you. And one other thing I just wanted to mention, besides the pH or acid alkaline balance of our bodily fluids, the ability of our red blood cells to take up oxygen, the amount of free radical activity, the stickiness of our blood, and our mineral balance all influence the kinds of organisms and diseases that can live within us, including our brain issues.